A nation shaken. The shadow of violence. India, a land of vibrant colors and rich heritage, is grappling with a dark reality. Amidst the celebrations and the daily hustle, there lies an undercurrent of fear and insecurity that cannot be ignored. The nation is shaken, once again, by the brutal rape and murder of a young doctor in Kolkata. This heinous act has sent shockwaves through the community, leaving everyone questioning the safety of women in our society. This horrific incident has ripped through the social fabric, leaving behind a trail of fear, anger, and a collective sense of shame. The streets are filled with protests, and the air is thick with the cries for justice. It has exposed, once more, the vulnerability of women in a society where their safety remains an ongoing struggle. Women, whether in urban centers or rural areas, face the constant threat of violence, making everyday life a daunting challenge. This tragedy is not an isolated incident. It is part of a larger, more disturbing pattern that has been emerging over the years. It is a grim reminder of the rising incidence of rape cases in India, a chilling testament to the deeply rooted societal issues that perpetuate violence against women. The headlines scream of the countless lives shattered, the dreams destroyed, and the families left in despair. The Kolkata doctor's ordeal has ignited a firestorm of outrage across the nation, forcing a long overdue conversation about women's safety, gender equality, and the urgent need for systemic change. The voices of the people are growing louder, demanding that the government and society take immediate and effective action. The echoes of this tragedy resonate far beyond the bustling city of Kolkata. From the metropolitan cities to the smallest villages, the impact is felt everywhere. They reach every corner of the nation, reminding us that the fight for a safer India, a nation where women can live without fear, is far from over. This is a call to action for every citizen, to stand up and be counted in the fight against this pervasive menace. It is a fight that demands our collective attention, our unwavering commitment, and our united action. Together, we must strive to create a society where every woman feels safe, respected, and valued. Only then can we hope to cast aside the shadow of violence and build a brighter, more just future for all. The Kolkata tragedy, a doctor's ordeal. The victim, a young and promising doctor, was working a late shift at a government hospital in Kolkata. She had always been passionate about her work, often going above and beyond to ensure her patients received the best care possible. She was dedicated to her profession, committed to healing and serving others. Her colleagues admired her dedication, and her patients trusted her implicitly. She was known for her kindness and her unwavering commitment to her duty. But her life was tragically cut short, a victim of a brutal assault that shook the nation. The news of her death spread quickly, leaving a trail of grief and anger in its wake. The details of the case are disturbing, a chilling reminder of the brutality that women can face. It was a crime that not only took a life, but also shattered the sense of security for many. The young doctor was raped and murdered, her body left abandoned. The sheer horror of the crime left the community in shock, struggling to comprehend how such an atrocity could occur in a place meant for healing. The incident sparked immediate outrage, with people from all walks of life demanding justice for the victim and her family. Protests erupted across the city, with citizens holding candlelight vigils and marches to honor her memory and call for change. The hospital, a place meant to be a sanctuary of healing, became a crime scene, a symbol of the vulnerability that women face even in supposedly safe spaces. The investigation into the crime was swift, but the damage had already been done. The tragedy sent shockwaves through the medical community, raising concerns about the safety of healthcare professionals, particularly women, who often work long and demanding hours. It highlighted the urgent need for better security measures in hospitals and other workplaces. The Kolkata doctor's ordeal is a stark reminder of the price that women pay for the lack of safety in their own country. It underscores the ongoing struggle for women's rights and the need for systemic change to ensure their protection. It is a price paid not just by the victims, but by their families, their communities, and the nation as a whole. The loss of a dedicated doctor, a beloved daughter, and a cherished friend is a wound that will take a long time to heal. The community's response, however, shows a collective determination to fight for justice and ensure that such a tragedy never happens again. Echoes of outrage, public response, and protests. The news of the Kolkata doctor's rape and murder spread like wildfire across India, igniting a wave of protests and demonstrations. The incident struck a chord with millions, resonating deeply with the collective consciousness of the nation. People from all walks of life, united in their grief and anger, took to the streets, demanding justice for the victim and her family. The protests saw participation from students, professionals, homemakers, and senior citizens alike, all bound by a common cause. Thousands of people gathered in Kolkata and other major cities, holding candlelight vigils, carrying placards, and raising their voices in unison against the rising tide of violence against women. These vigils were not just a show of solidarity, but a powerful statement against the systemic issues that perpetuate such crimes. The protests were a testament to the collective outrage, the shared sense of grief, and the growing demand for change. The streets echoed with chants and slogans, each one a cry for justice and a plea for a safer society. The medical community, deeply affected by the tragedy, was at the forefront of the protests. Their participation highlighted the vulnerability of healthcare workers and the urgent need for better protection and security measures. Doctors, nurses, and medical students organized marches and demonstrations, demanding enhanced security measures at hospitals and other healthcare facilities. Their voices added a critical dimension to the protests, emphasizing the need for systemic changes to ensure the safety of those who dedicate their lives to saving others. They called for stricter laws, faster trials, and a more responsive justice system. The demands were clear: immediate action to prevent such heinous crimes and swift justice for the victims. The protests, while fueled by anger and grief, also offered a glimmer of hope. They showcased the resilience and determination of the people, their unwavering belief in the possibility of change. They demonstrated the power of collective action, the potential for change when people come together to demand justice and a safer society. The unity displayed in these protests was a powerful reminder that, despite the darkness, there is always hope for a brighter future. Section 4. A disturbing pattern. Rape cases on the rise. The Kolkata doctor's tragic death has brought into sharp focus the disturbing rise in rape cases in India. Statistics paint a grim picture, revealing a deeply troubling trend that demands immediate attention and action. According to the National Crime Records Bureau, a rape is reported every 16 minutes in India. These figures, while alarming, likely represent only the tip of the iceberg. The stigma associated with sexual assault, coupled with fear of retaliation and a lack of faith in the justice system, prevents countless victims from coming forward. The underreporting of rape cases is a serious concern, masking the true scale of the problem. It is a silent epidemic, hidden in the shadows of fear and shame, perpetuating a cycle of violence and impunity. The rise in rape cases is a complex issue with deep-rooted societal causes. It is a reflection of the patriarchal norms that still hold sway in many parts of India, the gender inequality that persists, and the lack of respect for women's rights. Section 5. Beyond Statistics. The unseen plight of victims. Behind the cold, hard statistics lies the human cost of this epidemic of violence. Each rape case represents a life shattered, a spirit broken, and a family torn apart by grief and trauma. The victims of rape suffer not just the immediate physical and emotional trauma of the assault, but also the long-term consequences that can haunt them for years to come. They often face social stigma, isolation, and a constant struggle to rebuild their lives. The families of rape victims also endure immense pain and suffering. They grapple with the trauma of their loved one's ordeal, the long and arduous legal battles, and the constant fear and anxiety that often follow such a horrific event. The impact of rape extends beyond the individual victims and their families. It ripples through communities, creating an environment of fear and insecurity, particularly for women and girls. It is a societal scar, a reminder of the work that needs to be done to create a safer and more just society for all.